for postpartum hemorrhage. Okay, now, so we're gonna call her Fluffy because somebody did. We're gonna say the lady was Fluffy. Now, you guys said retained placenta, placenta abnormalities, placenta previa, abruption, accreta. One of the three are not correct. Which one is it? One of these three is wrong. Which one is it on that show that you watched? Yeah, she did not have retained. No. It's impossible. Oh, let me holler at you. It's impossible to have a retained placenta if I cut you, because I'm taking it out myself. You feeling me yet? Okay, so, but she did have one of the biggest reasons for death, and it is not always something we can do anything about. In her case, it was this one. Oh my God, when the test gives you this, and by the way, they give it to you as a case study. When the test gives you this, most people are like looking cross-eyed and crazy because it's not something we talk about in school. Definitely not even something I necessarily talk about, except I really wanted you to see this episode of Grey's Anatomy for this reason. Here's what it means. You know how the placenta is attached to the uterus in mommy? Okay, so let's take this baby, okay? We're gonna take the baby, we're gonna take this stethoscope, we're gonna show you how this shit works. Okay, so this baby is in a water balloon. You already know this shit. The baby is in a water balloon, and the baby's umbilical cord, long cord, really long, is attached to the placenta. You with me? Pretend that this right here is all placenta. Are you still with your girl? Yes. Okay, so here we go. This placenta, which is almost the size of a placenta, this placenta is strongly attached to the inside of the mother's uterus. So attached that when I try to take it off in surgery, I've got to work hard. So attached that some doctors who are rushing your vaginal birth are yanking and tearing it instead of being patient and letting it separate on its own, because he didn't make mistakes. God didn't make no mistakes. He made us perfect. The whole fucking thing is part of life, not a mechanical procedure. Okay, so here's what happens. When I was, training all them years as an RN, I would see the doctor come in, the baby was born, he want to get out of there and get gone. He started pulling on the cord, having her push, then he mushing her all in her damn stomach. Now, you shouldn't have to work harder on the placenta than you did that little joke over there. Why are you working this hard on a placenta? It must be allowed to separate. So your job, nurses, is to remember you got 30 minutes for that placenta to separate. That is max time. Average is 10. But he don't want to wait. He just delivered the baby. Now, what do I do? Because I'm patient and I want nature to take its course. Watch this. I literally take my hands and I do them like this. And I talk about the baby and who it looks like and what all the lady did that was perfect. And oh my God, your husband's a hero. He was all in. I do that. And just talk. Just enjoy the fucking moment, because God all up in the room anytime you just brought life in there. So just enjoy the shit. I don't do nothing with the mother. And I watch. You know what you're watching for? 3 things on your test. The cord itself, remember where it is. Once you take the baby out, you cut it. This is hanging out of the vagina. It's hanging out of the vagina. This is still attached to the uterus. When this part detaches, number 1 is the cord gets longer. You will literally see the cord getting longer out of the vagina, because what happened is a placenta just dropped into the vagina. It was up here in the uterus. It's done. It's done its job. It's separated. It's dropped into the vagina. So the cord gets long. You better remember that. Lengthening of the cord. Number 2, when this is ready to be delivered, you will see a gush of blood. You'll literally see that because it's from the placenta dropping and pushing out some blood. And you'll see it. I teach it all the time. The last thing that happens is her belly that was like hard up here will go down because it just lost its placenta and it's hard down here. Perfect. So fundus is firm. Placenta is ready to just gently deliver. You ain't got to tug at it. You ain't got to pull it all hard like a nut job. What happens when you pull hard is you leave pieces. You leave pieces in there because you tore it. That's why when you did clinicals, if you were blessed enough to do clinicals, you were taught that after the placenta comes out, the nurse looks at it to make sure it's intact and there's no like missing big ass patches and shit because it's still in this damn patient and it's gonna kill her if you don't get it out. Okay? All right, so we got that. We got all that. We good. We're doing good. Now, this lady did not have that issue because with the C-section, you can see that you got it all. Y'all see where we're going? Okay, now, but she sure in the hell had this. So what does that mean? Oh my God, it's horrible. It's really rare. Make sure you know that. Placenta accreta is really rare. Make sure you know that. This placenta didn't just attach to the uterus, it invaded the uterus. And it's never going to give you lengthening of the cord, a gush of blood, fundal firm. It's never gonna do it because it grew into her uterus. So technically, and this has happened, it's very, very, very sad. The only way to get that out of there is to do a fucking hysterectomy because it grew into the uterus. You got to take the placenta and the uterus out together because the more you try to get this out, it's grown into it. You can't. That is one of our reasons for death. Sometimes, just like you saw on Grey's Anatomy, sometimes not. It just depends on how well grown into it is. It's not something we see very often, may not even be something the ultrasound tech is looking for. It's just, we're looking to see that the placenta didn't cover the cervix, remember that? Preventing the baby from coming out. Remember I said it, placenta previa prevents baby from coming out because it's down here where it does not belong. It wasn't supposed to attach down there. And this does not hurt. It's painless. PPP, baby. Placenta previa painless. PPP. Placenta previa painless. PPP. That's going to be the biggest trick for you on your test because they love this. They love placenta previa and abruption. Abruption, oh my God. Anything abruptly happening is going to hurt.
You said it prevents the baby from coming out.
Because it's attached, it's in the way of the vagina. It's down here, it's way down here. Your placenta is usually here, 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 even back of your uterus, wherever it want to be. Being down here, the baby's above it, you can't deliver like that because the placenta is a bunch of blood vessels. So if a baby tried to come through that, which it couldn't anyway, if it did, it's going to pop and blow every blood vessel, which is why they bleed. Because when you start to dilate, they bleed.
Well, what causes that?
Well, fibroids in the uterus take up competition for where the placenta should attach. So if a woman has a lot of fibroids in her uterus, the baby is very bougie. They want their own nice apartment where did nobody else live there before them, and they don't want no competition or roommates. So they pick an area of the uterus that has had nothing in it ever. Not a brother or sister before them, not a fibroid, not a surgery, not a C-section scar, See, this is why we used to say you can't get but so many C-sections, because every time we make a scar, we predispose you to these placental abnormalities. Okay? All right, so you got it. You got it going on. Now, you got to remember on your test, this is rare. Y'all good?
What's that PPH?
Where, baby?
PPH. What's that?
Previous postpartum hemorrhage. So that's a risk if you bled before. Now, we got a lady over here. Y'all did real good. You already figured out what she was at risk for. I'm going to hit every one of these and you're going to say yay or nay. Let me read it again because y'all be on track. 38-year-old, gravid 6, pair of 5, spontaneous vag delivery at 6:20 p.m. No known drug allergies. Came in at 4 p.m. after her water broke, spontaneous rupture of membranes, and labor. Pain started immediately after. She went pretty quick. Her estimated blood loss was 300. She had second-degree laceration, which was repaired. Her baby boy weighed 9 pounds, 6 ounces, 4,252 grams. And the family wants him circumcised. She breastfed for 15 minutes. Everything went well. APGARs were 8 and 9, blood sugar 49. You just heard your colleague say that was on her test. I'm not just making up numbers. I know what's on the test. So blood sugar 49 at 6:50 p.m. Intravenous lactated ringers with 30 units of Pitocin in after delivery, 500 milliliters in so far. She has an ice pack to her perineum. She has 2 18-gauge angios, IVs, left and right hand. Her fundus is firm at midline and the umbilicus. She voided ×1. She peed about 200 milliliters at 6:50 p.m. Her vital signs, 36.9, 108, 100 over 62, 20. Pulse ox 98% at 6:55 p.m. She rates her pain a 2 out of 10, declines pain medicine. She is O negative, rubella non-immune, and she's group beta strep negative. Last week you recognized and analyzed cues. Now you're going to remember what you chose. I'm going to put a star near everything you tell me, yay. No. No. This is labor. This is postpartum. Be careful on the test. I'm going to try that again. This is Pitocin use in labor. It is a risk factor. This is after you deliver. It's a treatment. You still with me? Okay. Magnesium sulfate? No. General anesthesia? No. So none of these were her risk factors, were they? Okay, what about multiparity? Yes. So you're thinking like an educated nurse with these patients, like, she has a propensity to bleed just because she's had 5 kids. That's it. Okay? 5 or more. Okay? Multiple gestation means twins, triplets, whatever. She got any of that going on? No. Fibroids? No. How about any kind of over distension of her uterus? Yeah. She does. She's got some over distension. It's just not due to these things, is it? Let's find out what is going on with her. Did she have any placenta problems? Nah. How about preeclampsia, HELP syndrome, or hypertension? No. Uh-oh, here's an over distension of her uterus reason. She had what? A large baby. What's that called on your test? Macrosomia. She could be a what? Diabetic, but they didn't give it to us in reports, so probably not. You can just have a big baby. The times I've seen people with big babies that were not diabetics is when one of the mommy or daddy was really tall. Height matters, okay? So I had a real tall female, little sweetie mommy. She had a 10-pounder. I had a real tall daddy before, basketball player. You guys would know if I said it. That baby was 10'10". Okay, so we already know. Okay, so polyhydramnios, what does that mean? Excessive amniotic fluid. Your belly extended because you got too much amniotic fluid. Okay, so we got multiparity. We got, this was the lady on Grey's Anatomy. We got the large baby. Do we have infection?
No.
What was her temp? No. So no, we don't have an infection. Was she a C-section? No. Was she a vacuum?
No.
Forceps? No. Did they say she was obese? No. So but don't be trying to call people fluffy. So she had 1, 2 risk factors. We came up with one more just in general. What was it if you look at this list? Her pulse was a sign. What was a risk factor? Her age. Very good. So what do we know about age? Not so much with this, but what do we know about age in general? The older you are, the more risk you have, and the likelihood of dying increases with age. Okay? The likelihood of dying increases with age. Now, so we're going to put them down. She got age. She got multiparity. And she has a big old baby, macrosomia. Now, you're the nurse and you're thinking about that. In my practice, I did not make every patient have an IV. No reason really, I had healthy people. If they wanted an epidural, fine. But this would have made me give an IV, right? So what am I trying to do? Prevent, predict, IV. You didn't have 5 kids, boo. I need you to have an IV. You don't get out of that. Okay. What else could I do to preemptively think it through? Like, I don't know. I'm gonna be careful on this. What could I do as a nurse other than just start an IV? Just knowing when I admit you getting this IV. What else could I do? Patients? No, we don't do that. No. Because we would have known by now. 9 months to figure it out. But what else could I do? We're doing that anyway, right? Because after we deliver, we're doing vital signs every 15 minutes times. But what did you say you was going to follow with this?
Vital signs.
What did you say? Okay, remember when we did this last week, only one of y'all seen that. So monitor the pulse closely, right? If I know you have a risk of bleeding, you getting that damn IVs, I'm monitoring your pulse closely. I'm hoping and praying your uterus gets really firm. You see where we're going with this? I'm massaging your uterus every what? 15 minutes. That was on your test. You're trying to prevent this. In the first place, massage the uterus every 15 minutes. Teach mom how to massage her own uterus, and that it should feel just like that ball that you felt when you did it. This is all on your test.
How long are you doing it for? Like, when you
Recovery is considered to be 2 hours down on the unit where she delivered. Very good question.
15 minutes for 2 hours?
Yeah, every 15 minutes for the first hour or until you send her upstairs. Because I'm not sending you upstairs if you weren't firm the first hour. So by the time I send you upstairs, I'm certifying that you're stable enough to go on less massages. Yeah, but the first hour to 2 hours.
Well, you put that spontaneous in front of the vaginal delivery.
It means I didn't have to do forceps or vacuum. She did it on her own.
So what do that precipitous labor?
Precipitous means what, y'all? We learned it last week. You went in less than 3 hours. Look at what time she got there. Delivered. Look at when labor started. 2 hours and 20 minutes. She went too fast. And look, that is a risk for postpartum hemorrhage. Going too fast is a risk. Now, you already know this is our issue right here. You know this is going to be the main problem right here. Your test calls it a boggy uterus, don't they? Something else you may have seen, tell me if you did in your world. Did you see this word? Or this? Subinvolution? Yeah, on the higher level questions, that's you. Subinvolution. It means the same. It means the same. Same. And it's scary, y'all. When you feel it, it feels like there's a bowl of Jell-O in her belly. That's what it feels like. When I go to massage her uterus, it feels like there's a bowl of Jell-O in her belly. It's supposed to feel as hard as this baby's head. Now I'm massaging and feel Jell-O. It's very scary, okay? Now, this is a very good test question. You walk in the room. The patient is in a pool of blood. They delivered 1 hour ago. You have options. Let's see what you want to do. Okay, here we go. You walk in, the patient's in a pool of blood. They delivered 1 hour ago. First, nursing action. Massage the fundus, start IV number 2, call the MD, O2 per mass, 10 liters, and check vitals. Raise your hand if you want number 1. Remember, we're not doing punks today. Real high, be proud and loud. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Raise your hand if you want to start that second IV. Raise your hand if you need to call the doctor now. 1, 2, 3, 4, 5, 6, 7, 8, 9. Raise your hand if you need to put that O2 on her and get that vitals, check the vitals. Okay, 1, 2, 3. Now, some people didn't vote because you're punks. We're going to do this one more damn again because you're punks. Now, this is your time, not mine. Look at the clock. Raise your hand if you like massage the fundus. Raise your hand if you like start the IV number 2. Raise your hand if you calling the doctor and say fuck it. Raise your hand if you checking them vital signs and giving O2. Okay, you're gonna get your ass whooped. All you call the doctor motherfuckers getting your ass whooped. Because what do we tell you about calling the doctor? Never call the doctor first unless you have RECCC. What was R? Ruptured uterus. What was E? Epiglottitis. What was C? Consent form not signed, or the patient don't know what the hell you're doing. What's the next C? Cataract surgery, patient complaining afterwards. What's the last C? Compartment syndrome with the cast. I didn't do none of that here. This is the answer. Yay! Yay! It's right, because the majority of y'all got that right. Now, I noticed that nobody say start IV number 2. That was good, because task like that. This is a very common choice because y'all love to check a motherfucker's vital signs. You just feel so comfortable with that answer. It's not usually what's done first. Remember what I tell you in toe-to-toe. Checking vitals are usually not what we do first. Okay? Hell no. They just sitting in a pile of blood. You get them up, they're gonna faint. No, hell no. Okay? Now, so listen, here we go. This last challenge, this right here is related to how many of these, yay or no. Is uterine atony boggy? Could that be caused or made patient be at higher risk with this one? Yes. How about this? Yes. How about that? Yes. We'll talk about it in a minute. And how about that? Yes. Okay, watch this. You can labor so long that after the baby's out, your uterus can't contract anymore. It's done. That's what that one is. This is a medicine that gives you so many contractions for so many hours. The same principle applies. Are you with me still? Magnesium sulfate relaxes muscles and nerves. Now your belly doesn't want to contract at all. General anesthesia does the same thing. You gave everybody a general, not just the patient, but her belly as well. All her muscles are like, ugh. Okay, is that making sense? Okay, is this related to this? Yes. After so many children, each child you have, you've got to work harder to contract to get it back down. How about this? Multiple gestation, twins, triplets, whatever. Yes. Yes, you blew the balloon up so damn big. So big. You've got to work extra hard to get it back down. It's over distended. Definitely fibroids. Absolutely. What about this? Ain't got nothing to do with a boggy uterus, does it? Placenta problems are separate. They have nothing to do with this. Don't check it on test. How about preeclampsia, HELLP syndrome, or hypertension? No, has nothing to do with the boggy uterus, but it does have to do with a possibility of getting what? Magnesium sulfate. Isn't that what we use for this? Yes. Now, that does not cause this, only that causes this. Okay? What about the large baby issue? Yes. What about diabetes? No, not really. Polyhydramnion? Yes, because you stretch the uterus out of shape. Infection, chorioamnionitis. Yeah. It doesn't want to contract. Your uterus says, if I'm infected, why should I close it up in me? I'm not going to do that. I'll just keep bleeding to get it out of me. Okay, that's what the infection and chorio is all about. C-section, vacuum forceps, no, those are trauma. That's trauma. Obesity?
Yeah.
No.
If obesity was one that make diabetes.
Yeah, obesity is not a risk for this. It's not a risk for this at all. It's a risk just because if you do have a C-section and you're a big person, I'm in there a long time. Yeah. Okay, guys, you did that damn shit. Bye.